Very, very few doctors will even recognize mold, toxic mold illness, okay? So let's get into it. Some of the common symptoms, which, by the way, will mask a lot of autoimmune. You might hear that a lot, that similarities there, or Lyme. And a lot of times we have autoimmune, Lyme, and mold all hanging out together, don't we? So common symptoms: brain fog, fatigue, moodiness where your mood changes up or down, depression, anxiety, intense PMS symptoms there, a lot of pain, maybe just a lot of flow, just a really difficult menses there. Hormonal imbalances is a big one, which obviously can affect all the above there. And we've got an actual clinical sign, which should be yeast infections. And commonly when we hear yeast infection, we automatically may think vaginal. But guess what? If you've got itchy ears, let's say your ears kind of itch, like there's just something in there you need to scratch all the time, that's pretty likely a mold or fungal infection, guys. So the ear canal, a skin fold. So if you ever notice any kind of weird kind of rashy thing, or it could be even actually you might see like a white coating, like below the breast, for example, or folds of skin, that can be a yeast infection actually, or again, a fungal infection there. Obviously toes is big because we lose so much moisture through our feet every day, and we're, you know, in a typically closed shoe environment most of the time, trapping that moisture in there. And it's very easy for fungal infections to get going in the feet and in the toenails, stuff like that. Random rashes throughout the body. If you just get, you know, a patch here, a patch there, and it's a little bit random, not really so much like a psoriasis or eczema, but these random kind of patches of, or several at the same time, or you notice they kind of get worse with stress or with certain things in your life that, you know, maybe like a flare up, then that could be also a sign of yeast infection or fungal infection, okay? Big one is chronic sinusitis, the sinuses, all these guys all up in here, okay? They of course, a lot of them dip. They have a dip in them, and they can hold pockets of fluid in there, microbiota, and these fungi and yeast can get in there very easily. We breathe them in all the time. We'll get to that in a minute, but we breathe them in. They kind of settle in there. We get a little bit of snot and fungus and funk in there, and then all of a sudden we got a colony, and then all of a sudden after a little while we've got biofilm, and now infections, or I should say prescription medications, are really not effective against biofilm. That's a whole nother video, but you know, hopefully I have time to talk about it. But chronic sinusitis, where you get a cold and it just really never goes away, or we may wake up in the morning and we're all filled up, or we may, you know, eat a certain food and it causes us to kind of flare up. Now, that is more related to histamine and food intolerance. However, if we're flaring up here, okay, and it just goes right to your face, again, we're looking at possibly some fungal issues up there, okay? And then UTI, urinary tract infections. Now, a lot of people, especially women, I've noticed, have quite a few UTIs. It's just they don't have clinical UTIs all the time. Clinical, where they're actually, you know, burning, it hurts to urinate, and pain, and you know, maybe even a little bit of blood they might see. And then it's clinically diagnosed as a UTI, you know, potentially with those symptom profile based on testing. My point is, I typically see patients that have a UTI. They say, oh, I've had, you know, maybe one in the last year or two. Well, that usually means you've had 30 or 40 subclinical that you may not notice, you know, the symptoms of, but it's all dysfunctional down there, right? So those are some of the symptoms you might associate with mold illness. And there's more, but that's just kind of a handful to get you started.